degenerates really very rapidly, and you end up with basically an unstable joint from very early age. It's supposed to be. What the scapula can do is it can elevate, depress, protract, retract. As it does that, it has to be able to rotate, that is, spin along its long axis. And with protraction, it spins anteriorly. With retraction, it spins posteriorly. With elevation, it's anterior, and depression, it's posterior. So what we're going to do is two passive physiological movement tests that will take it to the extremes of all those ranges. Protraction and elevation will take it to the extremes of those two ranges, and both of these will produce maximal anterior rotation or anterior spin. Depression and retraction will take it to the ends of those ranges and posteriorly spinning. So we only need to test those two quadrants. And then we can overpress the rotation, the spin for the end. Is that okay? Now, I don't think these tests are really terribly necessary. Because you really don't have a muscle that can limit the AC joint movement, so it's got to be intra-articular or it is articular. So, but it's on the curriculum for now, so let's do it anyway. Lay yourself down on your side, so we're in exactly the same position. Come a bit closer to me. There. This can come back up in that same position there. And then I'll take her into depression, retraction. This time hold the scapula in that position. And I'll put my fingers on the top of the clavicle and tip it backwards. All right? So I'm not on the front of it, gliding it. It's on the top and just tipping it. Okay? So it's basically that. Hold the scapula and then just tip it further into posterior spin. Anteriorly, we'll take it elevate and protraction. And now again, I'm going to come onto the top of it and spin it forwards. So it's not grabbing the back of it, gliding it, it's spinning it. There. And that. Is that okay? That easy. So can I show you the glides as well now?
Yes.
All right. Let's sit you on the stool first. Chair's better, but the stool will do. On average, these are anterolateral posteromedially orientated. All right? So the glide here is to stick my thumb behind the clavicle, stabilize the coracoid there and the shoulder and our whole body, and then just glide. I'll come over that side. And just glide the clavicle anterolaterally. Is that okay? No problem with that? For the posteromedial glide, the easiest thing to do is stabilize the scapula, put my femur onto the clavicle there, and glide the clavicle posteromedial. Enough? Inferior glide, just grab a hold of the shoulder with your fingers and just gently push down with your thumbs. There. There's a posteromedial glide. And there. With the inferior. Alright? And superior. Come on to the acromion now. Push your acromion down.
You know, the counter portion.
No, actually, because she's already depressed, it's not going to go very far.